Hi, I'm Greg McIntyre, and welcome to the Elderlaw Report. And today, I'm extremely honored to have Dr. Buffy here. Dr. Buffy Lloyd-Krejci, who is an author, also dubbed the Germ Slayer. I want to get into that, what that's about. But I know that you've written an amazing book. This is an interesting topic. We're going to look at the state of the nursing home industry prior to the pandemic, during the pandemic, and then things that need to change in the industry post-pandemic, and what Dr. Buffy and her teams are doing to affect that change in training in Washington, D.C., in health departments, in nursing homes. And I just think this is an extremely interesting topic, and I can't wait to get into it. So tell me, Dr. Buffy, how can people find you? They go to drbuffy.com, right? Spelled out. Dr.
Right.
Buffy.
Yep.
Okay.
Well, first of all, Greg, thanks for having me. Of course, I appreciate the opportunity. Yes, they can find me at Dr. Buffy. It's spelled out drbuffy.com. Also, ipcwell.com is our company business website as well.
Sure. And give me a little bit of a history and background of who you are. You are a medical doctor. You have a doctorate in public health with a specialization in epidemiology. Is that correct?
Yes. Yeah. So doctorate in public health, specialization epidemiologist. I'm not a medical doctor. I'm not a physician.
I'm sorry.
No, that's okay. I just want to make sure.
When I hear epidemiology, I'm like, medical doctor. Yeah.
No, I didn't go to medical school, so I want to be clear about that. But I did plenty of schooling for my doctorate. So I've worked in healthcare since I was 17 years old, so for 30 years now, and various roles. And really, it's been the last 15 years that I really dove into the epidemiology. And I really loved medicine and mathematics and data. And I was like, how can I utilize both? Well, I had no idea, but I had luckily professors and universities that really showed me this path of using data to understanding how infections spread throughout the communities or different diseases. And that's really been my journey over the last 15 years. I have been working at the national level since 2016, when I started working with nursing homes on a national pilot project to have them start reporting an infectious disease into nursing homes. And it's at this time that I learned that there's 1 to 3 million infections occurring in nursing homes every year that result in a little over 1,000 people dying every single day from infections. And this is before the pandemic. And so when I really learned of that information, there was something inside of me that was captivated and really eager to look at this and work on it, because as I kind of looked around, I realized we weren't really, as a nation, doing too much towards preventing these infections. And so I've really made it my mission since then to reduce these infections, to prevent harm to our vulnerable residents and harm to our healthcare workers that work in this industry every day.
So that's the germ slayer part, right?
Yeah. Well, Buffy the Vampire Slayer, you gotta.
I like it. I get it.
I lived with this name, so.
That's awesome. That's phenomenal.
I didn't come up with it, if that's any consolation, of course.
Well, it's catchy. So
there you go.
So tell me about, where the nursing home industry was pre-pandemic, during the pandemic, and then what it needs to do coming out of the pandemic.
Sure. Well, this is really, you mentioned my book, Broken. This is exactly what my book describes.
Sure.
And in my book, I wanted to give a description of this healthcare industry, just similar to what I just said, as far as the public isn't aware of the vast amount of infections that are preventable within this healthcare setting. As an industry, we have focused a lot on areas other than infections. And rightfully so. We have focused on reducing falls, reducing antipsychotic use, reducing harms and neglect. All of those are critical components to patient safety. But we haven't done a super great job at preventing infections. You know, I mentioned there's up to 1,000 people dying every day from these infections. That can be from a wound, sepsis, influenza, pneumonia, multi-drug resistant organisms. I mean, the list goes on. And the research demonstrates that up to about 70% of these infections are preventable. And so if we know that we can prevent them, you would think we'd jump all over it to actually be preventing them. But like I said, we've had other priorities. And in 2016, a new federal rule came out through CMS that indicated that basically made it mandatory for all CMS certified nursing homes to start working on this, to start implementing infection control practices, a program, antibiotic stewardship, as well as to have a part-time infection preventionist on site. Excuse me. And so this was in 2016, and really over 2017, 2018, 2019, we were slowly marching forward. I would say that we were making some progress, starting to get our foundation situated, started to really start tackling, at least getting a foundation for infection control in our buildings. And then 2020 hit. And, the nursing homes, I would say, were the very least prepared for COVID-19 because we were just getting our foundation started. And it was in the nursing homes that not only were we the least prepared, but we were also a high target of punitive action from the government, from federal surveyors, state surveyors. And so as I supported nursing homes across the country, I saw this outcry for help and assistance. And that's truly what motivated me to write the book, is to answer the call.
So not to demonize the nursing home industry in any way, but to say, but I mean, you actually support them and help them with services, right?
Right. So I have.
But you recognize the need to change, that they need these services.
Yeah, and they do too. And so the reason I wrote Broken was because I have met, I was in over 200 nursing homes during the pandemic. Myself and my team were in 20 to 30 buildings every month, offering infection control support. We come in as coaches. We come in to support and help. There's very, very few opportunities like this. Usually all the nursing home gets is a surveyor coming in telling them what they've done wrong. They can't offer advice on how to fix it, and they're usually given citations. Well, we absolutely 100% need to know what's going on to fix it. Our nursing homes want to know. They want the help. They want the assistance, and they're hungry for it. But we have to stop. We need to balance out this punitive nature versus collaborative. And I would say that it's really swung far to the punitive side, where it really needs to, we need more funding for the collaboration, because like I said, I've seen some of the
father, if I came in and punished my kids, but I didn't give them any life skills or tools to change and to do the things they needed to do to stop the behavior or stop the actions that I'm punishing them for. Right? I don't give them the skills. So that's where we are.
And I'm not saying that the nursing homes aren't. So some may argue they're given what they need. They may be given a plethora of tools, of trainings, but there's very little person-to-person training. It's very much read this manual, here's maybe a webinar. We'll do a virtual visit. But when we go on site and we actually see the needs, we don't work with the leadership. We work with the frontline staff, because they're the ones that need the training. They're the ones that don't have the training. Especially now, staffing turnover is such a huge issue that you have, one of my colleagues, she's in a building right now in Minnesota, and she just called me and she said, Buffy, the unit secretary is doing the laundry. It's like they're pulling people wherever they can. And so we go in and we're offering this training. So we need to understand as an industry, and this is why I wrote the book, we need to stop vilifying these nursing homes, and we need to stop vilifying them as these horrible nursing homes. I understand the care that can come out can be horrible at times. I'm not denying that. But why is the care horrible? What's underneath that? And let's address that and fix it, instead of just constantly pushing the blame and saying, well, we're going to fine you millions and millions of more dollars and that's going to fix it. It doesn't. That's not what fixes it.
It might hurt it because there's less money to.
Yeah. Like, I
mean,
I was helping a building last month in Michigan that the owner has mortgaged his home. They're in 3 different citation series. They are in non-payment, so they can't even get paid for any new residents. So how do you run a business under those conditions? You can't, right? And I'm not saying that the nursing homes are without fault. I'm not even saying that there's not corrupt people in the nursing home industry, because I know there are. And what I'm saying is we need to really look at underneath what's happening and start looking at the solutions. During the pandemic, what I saw was, so every healthcare setting had their surveys halted, their annual surveys, their CMS surveys, except nursing homes. And the surveyors would go in during an outbreak, and instead of offering support and help, they would hand out citations. And some might say, well, that's good if they're not delivering good care. But what I observed was not just based on bad care. It was based on an emergency situation happening and not having enough staff and not having PPE, and basically being punished for that type of situation. And it's not appropriate. That was not an appropriate situation. And so we need to look at that. $80 million was funded towards this type, so to go out and basically do these surveys. What if we had used that $80 million, or at least some of it, to have more
PPE on those things,
on say more strike force teams to come in and work side by side with the facilities to help them.
Understood. That's
so I'll just, I'll add, so a lot of people don't know this, but Doctors Without Borders, the international humanitarian organization, came to the U.S. for their first U.S. mission in Detroit, Michigan in June of 2020 to help nursing homes. Now, mind you, they'd never, ever had a U.S.-based mission. And what they chose as their first U.S.-based mission was nursing homes because of how hard hit they were. Right. fortunate to be a part of that team. I was the infection prevention manager for that team, and we were able to create a playbook of how to support nursing homes. We did that for 3 months and then went on to support nursing homes in Houston, Texas. But would you believe that our biggest challenge was actually getting in the door to help these nursing homes, because they were so afraid of us, of the punitive. They thought we were the punitive side. They're so used to being punished that they didn't want to risk having licensing show up, you know. And then also we would be turned away if the licensing agency was in the building doing a survey. And so we couldn't even get in there to help them. So it says something to me when you have this global humanitarian organization.
Sure.
They said this was their most unique mission they had ever had, and one of their hardest, because of so much of the red tape and the regulations really holding and confining us to be able to really help them the way they needed to.
So how do we fix that? I'm sure you address that in depth in your book, Broken. If I want to read Broken, where do I go to read?
Well, it's on amazon.com.
Okay.
And it's available in paperback, Kindle, and hardback. And I am currently working on the audio version too. A lot of people want to.
I need the audio.
I know. Yeah. So
the car and in the gym.
right. So, yep, that'll be here in a few months. But I'm also excited, as we mentioned, we were chatting earlier, I am writing the second book, because when I was writing Broken, the last 4 chapters are solution-based, but I knew when I was writing it, I was like, I can write a whole book about the solutions. Well, that's what the second book is about. Okay. And I'm really excited about it because, you know, it was very difficult for me to write Broken because it really does share. I mean, it's interviews, it's just, you know, real people's lives and what they went through during the pandemic. And I interviewed patients, I interviewed family members, I interviewed healthcare workers. And, you know, like I said, I'm an advocate to long-term care. I'm not trying to blast them, but I'm also an advocate to the consumer. And as consumers, we need things to change. And as healthcare workers, we need things to change. And so instead of fighting each other, like, let's bridge this gap and start working together to create a healthcare system that is actually a whole healthcare system that can provide the services that our vulnerable family members deserve.
What a concept. You get both sides right. together and look at the solutions and achieve those solutions, right?
Well,
what if Washington, D.C. works that?
Well, well, here's the thing. So, because truly, even advocacy groups, you're either the advocacy group for the nursing homes or you're the advocacy group for the family members. And I'm like, why aren't we really working together? Because the healthcare workers aren't happy. You know, you can be the best nurse that comes out of your graduating class. And if you have to care for 20 residents, can you honestly deliver the care?
I have people in my law office as an elder law attorney, okay, who used to work in nursing homes as nurses, okay?
Right.
Like CNAs and RNs, okay? And they tell me horror stories all the time. And they're good people, and they're great people, you know?
Right.
But
and so it's the tenure of a nurse there is very small, a CNA. We've got to create an environment that is attractive and can sustain our staff, because
long term until retirement.
Long term, right?
Yeah, I don't think the nursing home industry is the only industry facing that problem. Okay, today, but yeah, I mean, think about a nurse with 25 years of experience, right? And how do you get there unless you hang in there to get that experience and you're paid well enough to support yourself to get to that point, right?
Right.
You keep hitting goals and increases in pay and responsibility and seniority, you know? I know that's part of the problem, right? And then what you're dealing with on the day to day, that's on the nursing home staff side, right? And then from a consumer standpoint, it's, hey, how can we pay for this and afford to pay this, right? And not lose everything.
And not just
when we
right.
do pay, we want to receive great care, right?
Right.
So there's competing interests there, but really everybody, I think, wants the same thing. And
I
that's
agree.
Right, for everybody involved.
I agree. I mean, in the first few pages of my book, I say, what is it going to take for us as Americans to say, I'll never go into a nursing home? Because that may not be our reality. I mean, I am 100% an advocate for home care and caregivers at home, but that is not the reality for a large percentage of people. And so let's,
for most people, for the largest
percentage. For most, and both my grandparents, I mean, my grandparents lived out their final days in a nursing home. And, I remember, I had that experience, and, same thing. My grandmother, she had nickeled and dimed and saved. And then at the end of her days, everything went towards her nursing home. So, I mean, I get it. I understand the financial cost of it, but more so, we don't want our loved ones going into the nursing home and then getting a stage 4 pressure injury or falling and hurting themselves or getting a staph infection and dying, or we don't want that either. So the problem is very, very vast, and I don't even cover all of it. I mean, my specialty is infection control, and so that's really where I focus. But you can't talk about fixing infection control and preventing infections without looking at the bigger picture of everything as well. So that's we try to touch on those other areas.
You do offer some solutions, and I know you get into that in your book.
Yeah.
Your second book, which details out many of the solutions. But from what I understand, I mean, your organization is really going in and working hand in hand with the team, the nursing homes on the front lines, to train and to individually identify problems and tackle problems, right?
Right. And what I will say is, first of all, I'm not against regulations. We need regulations. We need the survey process 100%. And CMS, Medicare Medicaid Services, Centers for Medicare and Medicaid Services, they're the funder of our nursing home care, most of it, right? They're also the funder of the survey process. They're also the funder for the quality side, the quality improvement organizations. And it's through that arm that our company is being funded to be able to provide these site visits. So, I give CMS credit for looking at what we're doing and what other, how this on-site boots on the ground work is really helping, that we're reaching our hand out across to the nursing homes and saying, we're here to help you. We're here to coach you. And we're not just going to give you, a 20-page report and say, here, have a good day, but we're going to help you do this.
Have you looked at how people, I'm sure you have thought about this, because you touched on it earlier, and this is where my mind went. And even on how you publish your books, you can read it on electronic, you can read it in paperback, you can read it, you're working on the audio version. People learn in different ways. They really do. So if I could give one person a workbook to do, or just a paper to read, and they may take a small percentage of that away, whereas another person, that's exactly how they want to learn, and they got it right. It just depends on the person, and we all learn differently. There are different learning styles, okay? So, but one way that is absolutely extremely effective is hands-on coaching, hands-on training, on the job training, mentoring, and apprenticeships. I mean, my profession, the legal profession, was an apprenticeship profession for the most part of its history until just recently, where you had to go to all this university education. True before. I mean, it was an apprenticeship profession. And then you sat for the bar, right? After your attorney that you had been an apprentice for a number of years said you were ready, right? So I mean, that is a great way to learn. That's the best way to train team members in our office. And, I would just think that that's part of the gap you're bridging there, is being able to identify specific problems and then offer real training that's really going to stick with and solve problems and stick with those team members.
Well, we do that. And we also, so, I mentioned in 2019 that there was a new CMS rule that required every skilled nursing facility to have a part-time infection preventionist. And that is now, I mean, surveyors are going to start citing facilities next month if they don't have that on board. Well, I would say 95% of these infection preventionists are green as green can be. And they take a CDC course and they're like, okay, now they've got their training. And they come away after, taking 23 hours of this online course, which is a good foundational learning. But they're like, okay, now what do I do? And so we really partner with them. My company, IPC Well, we actually created a hands-on learning library, because the number one thing we heard from these infection preventionists are, I don't know where to go for material. I don't know what to do. So we offer this free. People can email me. We can sign them up for that. They can email me at drbuffy.com or drbuffy at ipcwell.com. That's a free tool for our infection preventionists. We made it and we're still building on it. It has 10 modules right now, and we're adding 30 more to it because we want to make their life easier. We know that the infection preventionists only, and that's one of our solutions. They may only have, 5 or 10 hours a week, especially right now, given the demands of the staffing, to really dive in and do their job. So if there's something that we can do to make their job a little easier, that's what we're all about. And that's our whole mission, is to help them to provide, safe care to the residents, and to save lives ultimately, to prevent these infections and to save lives.
Well, I can't thank you enough for coming on the Elder Law Report today. I know this is an amazing topic, an extremely interesting topic, and maybe we do a part 2 when you come out with a second book, and let's talk about more solutions, right?
That'd be great.
Yeah, I appreciate you being my guest today on the Elder Law Report. And again, people can find you at drbuffy.com, and they can contact you there. It sounds like there's a ton of resources for people in the industry, for people that are interested, for people that want to read the book. I know it showcases the book there. Again, you can get the book broken on Amazon, Kindle, and where else?
Amazon. It's on Barnes and Noble's online, Walmart online.
Everywhere. Just Google.
Yeah.
Okay. Well, thank you so much. I'm honored to interview you today. And anything else? Do you have anything else that you'd want to say in closing? How about that?
I mean, I just thank you for the opportunity. Any opportunity to continue advocating for change and to help this industry. Like I said, our consumers want it, and so do our healthcare workers. And so let's bridge that gap, and let's create a system that really can support everyone.
Run for office. I'm going to vote for you.
No!
All right. I'll see you later. Thank you, Dr. Buffy.
Thanks, Greg.
All right, bye.
Please don't wait till it's too late. Call McIntyre Elder Law.